DACA recipients lose ACA health coverage. What you need to know. A recent policy shift has left many young California residents who entered the U.S. as minors without legal documentation, grappling with the loss of their Affordable Care Act, ACA health insurance coverage. This decision has sent shockwaves through the community, leaving many wondering what lies ahead. But here's where it gets controversial. Some argue that this move targets a vulnerable group, while others believe it upholds the law. Let's delve into the details. In June, the Centers for Medicare and Medicaid Services announced a policy that reclassifies Deferred Action for Childhood Arrivals, DACA, recipients as not lawfully present. This means that as of August 31st, these individuals will no longer qualify for ACA benefits. The decision reverses a previous ruling made during the Biden administration, which allowed many DACA recipients, often referred to as Dreamers, to sign up for the first time in November of last year. Jessica Altman, the executive director of California's ACA marketplace, Covered California, expressed her frustration, stating, "It's deeply unjust to penalize hardworking, tax-paying Californians who relied on the assurance of health insurance for 2025, only to have it taken away 8 months later." Approximately 2,300 of the estimated 150,000 DACA recipients living in California have enrolled in the ACA since becoming eligible. Altman mentioned that convincing more to join was challenging due to uncertainties about the future of this expansion. She lamented, "We hoped for more time, perhaps years, to strengthen our outreach efforts, foster trust, and increase enrollment among eligible DACA recipients. Unfortunately, that progress has been undone." Covered California is taking proactive steps to inform all affected DACA recipients of the policy change and is collaborating with community organizations to explore alternative coverage options. Altman emphasized, "This isn't something we want to do, nor does it align with our values or mission, but we must adhere to federal regulations." However, she fears that some individuals may slip through the cracks. Mariam, Arif, the communication director of SIREN, a nonprofit organization offering legal assistance to immigrants in Santa Clara County, shared her concerns. Losing ACA coverage will force many DACA recipients to forego necessary health care or bear unaffordable out-of-pocket expenses, especially when access to care is crucial, she said. "It's not just about money, it's about cruelty. DACA recipients contribute billions in taxes each year, including to Medicare and Social Security, benefits they won't be able to enjoy. We see this as incredibly heartless." Most DACA recipients who signed up for the ACA were motivated by the same factors as other Californians, according to Altman. These include gig economy workers, those retiring before 65, and part-time employees without substantial benefits. They lack stable health benefits through their employment and are ineligible for Medi-Cal. While this change impacts only a small percentage of California's DACA population, Altman and Arif warn that further rollbacks could be on the horizon. Altman highlighted new federal budget proposals that would cut funding for several lawful immigrant groups. As well, she noted, starting in 2027, refugees, asylees, and humanitarian parolees will no longer receive financial assistance from the federal government, a situation we're monitoring closely. Arif concurred, suggesting that these cuts are part of a broader strategy to dismantle federal protections targeting immigrant communities. Altman advises affected individuals to stay alert for communications from Covered California, which may offer alternative routes to affordable health care. She stated, "DACA recipients are unfortunately accustomed to unpredictable federal policies that significantly affect their lives. We'll be reaching out to you with messages and calls to help you explore your options." Arif encouraged DACA recipients to remain resilient, maintain hope, as numerous actions are underway, and we're optimistic that a positive outcome will emerge, she concluded. Originally published August 2nd, 2025 at 4:35 a.m. PDT.